Hello, everyone, and welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst. So I launched Revitalize MD in 2017 with the mission to help patients find solutions to looking, feeling, and functioning better. Those solutions that traditional medicine just did not offer. And I am a traditionally trained MD with a specialty in emergency medicine and have practiced for 25 years in the emergency room. And during that time, I started to notice changes myself. And I wasn't the only one. I had colleagues. I would hear it through patients. And, the end results of all those workups were always the same. Everything looks normal. And so as I started my journey into anti-aging medicine 10 years ago, or greater than that now, I realized there's lots of different solutions. And so I wanted to comprehensively bring those to patients to look and feel and function better. And through this podcast, I'm really hoping to reach more people so that we can get information out there. So I thank you for joining us today. And I have a couple guests with me. So I have Bella first. And Bella, you want to introduce yourself?
Hi, I'm Bella. I'm a patient coordinator at the office. I've been with Dr. Durst since basically the beginning. She is a big mentor of mine. She is very well educated. I look up to her. She's one of the smartest people I know, and I'm very glad that I get to learn from her every single day.
I'm Samantha. I have also been with the office since almost the beginning, and I am the office manager at Revitalize, so I do work very closely with Bella and Dr. Durst as well to make sure that patient experiences are the best they can be.
Well, awesome. And so today I was thinking that maybe we would cover something that comes up quite frequently. And I know you girls get questions about this at the front too, and on the phone, and even when you're in patient rooms. So what's the difference between Botox, Dysport, and Xeomin? And so for a moment, before we even get into that, Bella or Samantha, why not one of you guys kind of explain what the overall term is, neuromodulators? I know you guys didn't know what that term was at the beginning, and I know a lot of our patients don't, and sometimes we mix, those brand names with the NM or neuromodulator or even BTA. And maybe you guys can tell them a little bit about what you know about BTA and neuromodulators now.
So we tend to see that people will call and they say they need an appointment for Botox. So Botox has just become a verb. And it actually, all three of those, Botox, Dysport, and Xeomin, are all neuromodulators, which are used to freeze muscles. So that's a very broad category, but it's typically just called Botox because that's the most popular brand, whereas Dysport and Xeomin do the same things. They're just different companies making those. So I think we find that there's just not, I think Botox is just the most popular one. And
so it's the most well-known, and that's what people are going to say no matter what. And it has become a verb. So if somebody says they need Botox, they're getting Botox, that just means they're going to make their lines from movement go away, right? And we're going to paralyze their muscles, but it doesn't necessarily always mean Botox.
I may butcher this, but BTA is
botulinum.
Yeah,
yep.
It's that, but...
So really BTA, botulinum.
Botulinum.
Toxin A.
So that's what that is, and it's also just a different term for neuromodulator or Botox, if you call it that. So, but again, just Botox, Xeomin, and Dysport are all the same thing, just different companies making a neuromodulator.
Yeah, I agree with that because before I started working at the office, I've obviously heard of Botox for years. You see it on the Real Housewives all the time. And the first time Dr. Durst said neuromodulator, I was like, what's that? I was like, I don't know what type of appointment to make. And so she educated me and said neuromodulator is actually the toxin, and Botox, Dysport, and Xeomin are all different. And you also... Botox and Dysport, in my mind, are a little bit more similar. Xeomin, especially for younger skins with less wrinkles in them, I feel like Xeomin's really perfect for it.
Yeah, people who don't want to be as frozen.
Yeah.
If they like that more natural appearance, they go for Xeomin, but she'll get into all the differences, but I do agree, yeah.
Yeah, and Xeomin, whenever I talked to the rep for the first time, I remember her explaining Xeomin. compared to Botox. Botox is kind of like an M&M, and Xeomin is like an M&M without the shell coating. It's a more organic version of itself. That's how she explained it. Yeah.
And it is good when they give you those visuals because sometimes it's easier to remember long term. So, and again, the reason why we brought up even BTA is because, and we won't get into the details of that, but we have a BTA club at Revitalize MD, and it allows you just to join in and pay for the year and then get a discounted rate of 25% on your Botox treatments. And again, Botox meaning the verb. Treatments for the entire year, and we call it the BTA Club. And so that's why we kind of brought that up. BTA meaning botulinum toxin A. That's the toxin in all of the neuromodulators, which brand name wise are Botox, Dysport, and Xeomin. And so botulinum toxin A is actually what goes in and paralyzes the muscle so that you don't get movement in the line. So well, perfect.
So what is the difference between, is there differences between those three? What are the?
Yeah. Well, let's go into all that because I think this is a question that I answer on a daily basis. And so you guys probably don't go into as much. You know that if somebody wants Botox, we put them down for an appointment. And then in the back, we're talking about what those differences are. But because we have that conversation every day and people don't know, we want to get that information out there so that everyone can know. So let's start with Botox since it is the verb or the product, and it's used, and it's the most well known. So everybody knows about Botox. 10 years ago, nobody knew about Botox, but now everyone does. So basically, Botox, again, is a neuromodulator and has the active ingredient of botulinum toxin A, which is going to go into the neuromuscular junction and paralyze the muscle. And so we'll do that in the area of frowning. So those 11s between the eyes, and you get the movement when you're frowning too much, or those forehead lines, in the crow's feet and forehead lines. And so, we'll inject small amounts, of each of these into those areas to paralyze the muscle. And so the difference really is Botox and Xeomin, for instance, and Bella hit it right on. Xeomin is a more purified version of botulinum toxin A. So if you have an M&M, the core is the botulinum toxin A. And so that's the active ingredient that's going to go in and paralyze the muscle so you don't get those wrinkle lines. And then you have a M&M coating, or the chocolate covering on the outside, or no, it's actually the coating. Sorry, the core is the chocolate. So it's a coating. So basically, Xeomin doesn't have that coating on it. And so it's more purified version. It doesn't have a protein that you're going to have to metabolize off to get the active ingredient. But the size of Xeomin and Botox are the same. Where Dysport also has the coating or M&M coating around it, but it is smaller than the other two. And so there's 3 Dysport molecules to every one of Botox or Xeomin. And so sometimes to me, that means maybe it gets into the neuromuscular junction a little bit quicker. And so you might get effects faster, or perhaps it lasts a little bit longer. And so again, it's all individual, and there's, differing opinions on that. But that's the big difference. And so we fixed it in the office where, again, no matter how you inject it, it's irrelevant to the patient because you're injecting the right amount of quantities into the area to get paralyzation and no movement. Mm-hmm. It's just that you have to do 3 times the molecules. The pricing is equivalent with all of them. And it's just backdoor, office math that we're doing otherwise to make up for that difference. So does that explain it now? And so that's why sometimes people will get a little bit confused, and we did pricing so that they don't have to, they just have to pick the product, let us know if there's a favorite of theirs. And we have those all available to use.
So I have a couple questions. So Botox, I know I've only heard it used as the name brand Botox being used to help with migraines or with sweating problems. Can Dysport and Xeomin be used for that too, or is that something that Botox is specific?
So all of them can be used for that. And so again, a lot of the FDA regulations will have FDA indications for certain product and not for others. And that kind of doesn't mean a lot to me because as a physician, I can use off-label FDA indications. So say, Dysport didn't have, jaw, because we can actually thin out the jaw a little bit with this. If somebody has, some big masseters and they have a square jaw, and it's really, the term is bruxism, if it's really bad. And say we're using that, for instance, with Botox. Maybe Botox has the indication and Dysport doesn't. That really doesn't matter as long as you have a physician or a provider that is comfortable injecting in off-label areas because it works. And so all of them can work for headaches, musculoskeletal stuff. And actually, 80% of pain in the head and neck is actually from muscular pain. So injecting it in the temples for temporalis relaxation for headaches, or, the masseter, the jaw for a TMJ or headaches, or even in the back. We can inject muscles, upper trapezius or occipitalis, those muscles in the back of the head that will cause pain and headache. So not something that a lot of people know and not a lot of providers doing, but absolutely they all work the same. They're all paralyzing the muscle.
I have a question for you, Samantha, because I know Dr. Durst is definitely more strong-willed when it comes to needles. Mm-hmm. In your opinion, do you think Botox and Dysport and stuff like that, do you think it hurts when it's getting injected?
No, not at all. So I hate needles, but I also love being frozen. So I have started doing Botox, or actually neuromodulators, regularly. So you're supposed to be getting them done every 3 months. But to answer your question, no. It's just a tiny little insulin needle that they use. So it's going like, I know some people are listening, so it's going like, how
very
long
super.
Are they? Yeah, superficial.
It's very superficial.
So there's little to no pain at all. The only thing that's weird is when I get to the end of the syringe, like you kind of feel like a little pumping, but that's like, it's just weird to me because it just is.
So it doesn't really hurt. It's just a little, it's odd feeling,
yes,
but not
uneasy. It's kind of
but not painful. And so actually that brings up a good point though, is that preventative at your age. So maybe talk a little bit about that. So Samantha just recently, probably within the last year, started getting it, and Samantha's now 20. And so maybe, talk a little bit about what you experience when you don't have it now and what you see in others now that you've had it.
So since I've started working at Revitalize, I'll just go a little backstory. I used to never notice wrinkles, lines on anybody. And now that I'm there, anytime I see movement, it drives me crazy. And I want to get them in and inject them. Not me, but have someone inject them because I can't stand the movement. So now when I see myself starting to move at all, even though I'm 20, I hate it. It drives me crazy. I like to be frozen. And I also think it's a great thing to start doing at an early age because you might not worry about it right now when you're 20 or in your late 20s. But by the time you're 50, it's going to bother you like crazy. So if you kickstart it and start doing it earlier, your muscles are going to move less. You're always going to be more frozen, and it's going to really help you because you will become self-conscious about it at that age. So if you just kickstart it, get going early.
And do preventative. And and that's the other thing. So not everybody needs to be frozen, but some people prefer it. So when a patient's in the room with me and we're talking about Botox, again, the verb, I'll ask them, do you want to be frozen? And if they look at me strangely, like they don't know what I'm talking about, that means they don't want to be frozen. They don't know what it is. Because when you want to be frozen, that means you don't want to see movement lines at all. And some people don't want to be like that. And it's okay either way. It doesn't mean fake. It means frozen, meaning you're not moving. But if you look at Samantha, you don't know that Samantha's gotten Botox. You can't tell. And so it's still a natural look. So people want to think that somebody's going to know and they're not going to be able to move. And so that's not the case, when it's done appropriately. We don't have patients in our office looking
Like
abnormal because
for
they got
the people
Botox.
watching, I could show you, but like I don't look fake at all. Like
No.
it just doesn't look like I have lines in my forehead.
And what
that's
she's
the only.
also trying to say that at 50, so don't be afraid of the needle, be afraid of the wrinkle, because at 50, you're going to notice the wrinkle, right? And so preventing at an early age is good because you just don't get those movement lines. And so, but you guys are really good about, knowing there's a lot of, information on social media now, lots of videos out there. And so a lot of people talking about it and getting these treatments at a younger age.
And then one other thing that we wanted to touch on is that you can actually use these neuromodulators to do a lip flip. So if you wanted to just go into a little bit, because some people are scared of lip filler, but there's always a more subtle option with neuromodulator called a lip flip.
Yeah, so we can use any of these, again, neuromodulators. We want to just get everyone used to our terms because we may use any of the three. We don't often say we're going to Dysport you or we're going to Xeomin you, although we use a lot of those products and we use a lot of Dysport. So, but we're never going to say that. So we're going to say neuromodulator. We're going to say Botox. So, but when we're doing lip flips, again, you can use any of them. So across the board, whenever we talk about this, it means you can use any of the products. It's a generic term. But when we do the lip flip, you're putting Botox in the border of the lip. And so then you can actually, the muscle above the lip is still active and moving. And so the border of the lip is not, and you get a little flip out. And so it's a very nice, subtle, really doesn't affect movement. And we have a lot of patients that want to do that, especially after filler in the lip. It's actually included in our treatments that a couple of weeks later, they'll come back in. We'll just make sure everything looks good. There's no issues. And nothing needs to be, or they don't have any other desires, but then we'll add that lip flip as just that little boost 2 weeks out when they're, kind of wishing maybe they had a little bit of,
Again,
a little bit of
people
volume.
too like the lip flips because you lose volume in your lips as you age also. So people that are younger just want a tiny little subtle lifting. So it's a huge thing in our age group as well. Yeah,
I definitely think that especially with me and Sam are both in the college age area, we definitely are starting to get a lot more patients are interested in lip flips and Botox because they do want to get more preventative. It's not as big of it's not as big of a taboo topic anymore.
Oh no.
And people are starting younger, which is good because a lot of older people used to think it was a scary thing because when you think of botulism going in your skin, like it used to be scary.
Toxin,
but a lot of people are starting to get more preventative, which I think is really good. And I like whenever I see patients our age coming in and getting lip flips. And I know some of my friends have gotten lip flips and they love it. And it gives you a little bit of confidence without getting lip filler because lip filler is on some people, it can be a very dramatic change, but with the lip flip, they just get a little bit more pout in their lips, which gives them the confidence that they need.
Yeah. And they really like it. It does seem to be a very popular treatment. So,
and I also think that skincare, which I won't go into deep, but involved with all this Botox stuff, there's tons of skincare products that you should be using as well for people our age, preventative, and also people starting a little bit later using skincare products to go along with these Botox or the neuromodulators that they're using to help prevent more wrinkles from forming. So skincare goes hand in hand with these neuromodulators. So that's something that's very important. And we would go over all of that in an aesthetic consult with you.
And I think everyone that comes in for an aesthetic treatment should have skincare addressed because you shouldn't spend all the money on getting prevention of movement and wrinkles if you're also not getting rid of dead skin cells and treating your skin the right way when it, turns over every 28 days. And so, some of the different areas, and they can add if I'm missing, again, 80% of musculoskeletal pain just in head and neck is muscular. And when we're paralyzing a muscle, you no longer get that pain. And so doing it in other areas, the back of the neck, there's, the trapezius and one just up above that. You can do it in the temple area and the muscle there, again, the jaw and the masseter. You can actually get a little bit of jowling as we get older from platysmal bands in the neck that pull down in the jowl area. So we can do it there to help with jowling, which is, again, a way that's less invasive than doing filler or threads or something else to lift in that area. And you may actually see improvement and like it. And bunny lines, where the nose, because we do it already in frown lines and we do it in forehead lines. And then we do it in the crow's feet area. But bunny lines are little lines around the nose some people won't like. We talked about the lip flip. And then also if somebody has a gummy smile, I see a lot of those. And people don't know how to fix those necessarily when somebody smiles and you see a lot of gum line. And a very simple fix with, a couple different injections of Botox that can fix that. So your gums just don't pull as high. And so that's another one that's very nice to use. And again, they're very small injections. They don't hurt. Nothing to be scared of. I think the thing to be scared of is, again, my little thing is the wrinkles. Don't be afraid of the needle, be afraid of the wrinkles. But that's because I'm older. And so, but otherwise, just be cautious on who you go to. You want consistent providers and injectors. And so this is simple entry level, stuff. And again, we want to get patients in and not have them worry about pricing and, shopping around and not getting it on a regular basis, because you do prevent movement over time. The more you get it, the less you need it. So if you're getting it every 3 or 4 months, you're going to need it less. You'll need less in the way of units. And then you also train yourself not to move. But likewise, then you get into the office, the same office, consistent injectors, consistent product. And so that's why we brought up that, BTA Club, is because then you get a significant discount on your treatment for the entire year. And then you feel less guilty about going in every 3 or 4 months for those treatments. But you're getting consistent providers, because you really shouldn't have too much in the way of complications from Botox. And do we ever see any complications for that in the office?
And I think, honestly, you save more money if you go to the same practice over and over again, because they get to know you. They get to know how many units you need. So you're not keeping going back more and more and more to get more units, because once they start to know you, they know how many units, they know where to place it will be a good, they know which type of product, whether you work better with Dysport, Xeomin, Botox. So altogether, you're honestly saving more money if you just stay with the same place. And 100%. I think Dr. Durst is a great injector, and we have other injectors. So
we're all trained by her. So they have the same methods as her. So
and I think you're right, though. When our first treatment and, our first patient visit in for Botox, I always say, we may get it a little bit wrong this first time, meaning you might need to come in and we might need to touch it up. I'd rather go a little light and have you come back and we add a few units until we know exactly what that patient needs. And so the less you have to do that, the less you have to go in and get touched up, the less you're paying ultimately in the long run. And then likewise, if you're there every 3 or 4 months, you get less in the way of units. You don't have complications that you're dealing with, because that is stressful as well. So, all around, just get those providers that you want to go to, over and over again, that you trust, what products they're using, how they're trained, and you're very comfortable with the office as well. So
if you want to get in for an aesthetic consultation, you can always call or text the office. You can also follow along on our social media. You can message us through there as well to set up an appointment.
And so if you have anything else any questions, any experiences that you might have had with Botox, Dysport, Xeomin, or any neuromodulators, then put it in the comment. You can ask us for sure if there's any topics that you want to cover or anything we didn't cover on this topic. Just let us know, subscribe, share with your friends. And again, we're here to revitalize your look, your health, and your sex life. So follow along.